So, microbiology affecting in biolife.
Microbiology affecting in biolife. Well, first of all, you have nurses and the center physicians screening for communicable and diseases that might affect the plasma. The plasma is manufactured into medication for people with clotting disorders. So it's also very important as far as whether you have the med historians who are doing the vitals, taking temperatures. That's really your first screening process. Your phlebs who are scrubbing the arm for a sterile technique, insertion of that needle, making sure the line is closed, not contaminated by air or anything else. So it plays a part in everything. Your hand sanitizing there too, before and after every single donor. So
I know you look at like if wounds are open, and why is it if a wound is open they can they donate or can they not?
It kind of depends.
Okay.
And I am probably a little stricter than most. If it is scabbed, it is closed over. I am generally okay with that because it is largely closed. I will take nothing in the scrub area whatsoever, not even a scab, simply because, and even though they are supposed to scrub out, there's a possibility that we could draw something from scrubbing out into
Okay.
that wound, and even that scab is still kind of porous, so I wouldn't take that.
Yeah, makes sense.
Yeah.
And so I know people are allergic to iodine, and I know that's what we use to scrub the
Right.
um
The insertion site.
there we go. So if they are allergic to iodine, do they use something else out on the floor?
We do. We use ChlorPrep.
Okay.
That is something actually that is used in the hospital probably more frequently now than iodine.
Okay.
Iodine's a little old school. That's more for the OR, but even for your central line ingestion changes and stuff, ChlorPrep is used. So they use ChlorPrep. If you have a problem with ChlorPrep at BioLife, then you're pretty much done. Because they have no way of cleaning that site appropriately if you can't use iodine or ChlorPrep.
That's interesting. I've always been curious of that.
Yep, ChlorPrep.
Okay. How do you handle a stressful day at work?
How do I handle a stressful day at work?
And this one's more towards the ER
The
than BioLife.
Basically what I do as far as when I'm in the ER in a stressful day, which is a lot of the time, is I just look at it as trying one task at a time, one multitask, taking it step by step, not looking at, well, I have 3 people, but there's 30 in the lobby.
Okay.
I just really kind of focus on what I'm doing at the time and one step in front of the other, and it'll all get done.
Okay.
That's the biggest thing there.
Have you worked anywhere else besides Stanford and BioLife?
I have. I also worked at Essentia in Fargo. As a nurse, I was an LPN in their urgent care. I have also been an LPN at Roger Maris Cancer Center.
Okay.
Yeah. And before that, I worked in a bank.
Wow. That's a big leap.
Yeah.
Well, thank you for letting me interview you.
No problem.
It's been very nice.